Welcome, everyone. Saludos, and thank you for joining us for today's Wellness Wednesdays, our sixth community engagement and research webinar being hosted by the Juan Antonio Corregel Puerto Rican Cultural Center of Chicago. Developed resources reported in this webinar are supported by the network of the National Library of Medicine, the National Institutes of Health, or NIH, under cooperative agreement. The content is the sole responsibility of the authors and does not necessarily represent the official views of the NIH. The sessions throughout the series will provide health education information and resources. Today's webinar discusses culturally responsive strategies for engaging Latinx aging adults in research. We'll hear from Dr. Marta Cerda, CEO of the ASI Home Health Services, and we're also joined by Dr. David Marquez from the University of Illinois at Chicago, who shares barriers and facilitators for recruiting and retaining older adults in research projects like Baila. Bienvenidos, mi gente. My name is Lisa Aponte Soto. I'm the founding president and CEO of Tanoma Consulting and the moderator of this webinar series. I'm a health inequities researcher and evaluator trained in public health, community participatory, culturally, and linguistically appropriate practices. Tanoma Consulting is a national nonprofit consulting firm providing transformative, culturally responsive research, evaluation, and training services to advance health, education, and workforce equity. To learn more about Tanoma Consulting, you can visit us at www.tanomaconsulting.com. Before we continue, I want to quickly introduce you to our team members for this project. Ms. Melissa Banerjee, Director of Development at the Puerto Rican Cultural Center of Chicago. Ms. Xiomara Rodriguez, Director of Digital Presence Initiative at the Puerto Rican Cultural Center of Chicago. Ms. Zenaida Lopez, Associate Director of El Rescate Transitional Living Program at PRCC. Ms. Emily Medina Rodriguez, Research Associate with the PRCC and Tanoma Consulting, and Kimberly Silva, Research Associate with Tanoma Consulting. We also want to introduce you to our esteemed liaisons. Dr. Aida Giacello, professor at Northwestern University, Feinberg School of Preventative Medicine. Nurse Susana Gonzalez, nurse consultant and educator with ASI Home Care and the National Association of Hispanic Nurses, Illinois chapter. Ms. Monica Rodriguez from the All of Us program. She is the Director of Communications and Engagement at Northwestern University for that initiative. We also would like to acknowledge our partners for this webinar series. The Illinois Precision Medicine Consortium for the All of Us project, comprised of 6 Chicago-based medical centers. The Puerto Rican Agenda of Chicago, a nonprofit organization comprised of local Puerto Rican leaders ensuring the self-determination of Puerto Ricans in Chicago, throughout the diaspora, and in Puerto Rico through policy and advocacy. El Rescate Transitional Living Program, a program of the Puerto Rican Cultural Center, which provides culturally appropriate, identity-affirming housing for homeless LGBTQ and HIV-positive youth, ages 18 to 24, through a continuum of solutions. Vida SIDA, a program of the Puerto Rican Cultural Center that provides youth access to the HIV prevention services, as well as employment, educational resources, and living skills training. Vida SIDA is located in the area that has witnessed the highest rates of HIV among Latinos. The Illinois chapter of the National Hispanic Nurses Association, a professional, voluntary, and nonprofit healthcare organization dedicated to enriching the lives of Hispanic nurse individuals through the promotion of academic attainment, mentorship, professional development, and actively reshaping healthcare in the Hispanic community. ASI and NAE and NE Healthcare Services, promoting healthcare support. You're here for our Latino population. You'll hear more about the ASI from Dr. Cerda in just a few moments. And Illinois Unidos, a consortium of Latino clinicians, elected officials, public health practitioners, educators, and community organizers addressing inequities due to the impact of COVID-19 in Latino community and beyond. Before we begin, we want you to know that we would like to know where you're from. So please enter your name in the chat box, what organization you represent, what city or neighborhood you're from. and share anything else you want to share with us today. If you have resources that you'd like to share, you want to give a plug to your organization, we'd love to learn about it. And finally, this session is being recorded to make it available to you following our discussion. We will now,
on behalf of the network of the National Library of Medicine, I'm honored to partner with the Puerto Rican Cultural Center to bring trusted, meaningful health information to you. The National Library of Medicine is one of the 27 National Institutes of Health located on the NIH campus in Bethesda, Maryland. It is the world's largest biomedical library, offering a vast print collection as well as electronic resources to researchers, health professionals, and the general public. The network of the National Library of Medicine consists of 8 regional academic medical libraries and over 9,000 partners nationwide that support the National Library of Medicine's mission to access and share health information and to raise awareness of the NIH All of Us research program to advance medicine, treatment, and care. And by funding partners like the Puerto Rican Cultural Center, together we can support the health information needs that are important to your community. So thank you for attending today's webinar. And if you would like to learn more about NNLM All of Us and the ways you or your organization can participate, learn, and work with us, please visit our website at nnlm.gov/allofus.
and you had just heard from our funding partner, Ms. Darlene Caskey, who serves as the Community Engagement Coordinator for the Greater Midwest region of the network of the National Library of Medicine. Now, we're excited to introduce you to the CEO of the Juan Antonio Correger Puerto Rican Cultural Center of Chicago, Mr. Juan Manuel Calderon. Mr. Calderon is driven to confront injustices that people of color face daily, particularly the Latino LGBTQ community. He's leveraged community and government support to address educational disparities and access to resources. Formerly, he assumed the leadership role of Vida Sida, an HIV prevention care and housing program, which is a project of the Puerto Rican Cultural Center. Currently, Mr. Calderon oversees several programs that can be standalone agencies. These include education, housing, public health, early childhood education, employment, urban agriculture, violence prevention, and arts and culture initiatives. Mr. Calderon is a recognized activist and a celebrated community leader who advises local, state, and federal legislators. He is passionately active in policy efforts in the Chicago City Council and the Illinois General Assembly. His recent accomplishments include the establishment of a transnational partnership with Cuba's National Center of Sex Education and TransCuba, as well as partnerships with the LGBTQ organizations in Colombia. Mr. Calderon serves on the Chicago Board of Health as a member and commissioner for the Board of Directors and serves as the treasurer of the National Museum of Puerto Rican Arts and Culture. He also serves on the Yates Local School Council and the Stowe Elementary Local School Council, the Illinois Commission on the Elimination of Poverty, the Board of Directors for the Advocate Bethany Community Health Fund, as well as the Chicago Low Income Housing Trust Fund, the Illinois Human Services Commission, and the Illinois Advisory Council on Youth HIV/AIDS Prevention. And finally, he also serves on the Trans Chicago Nonprofit Initiative. His efforts have been recognized by La Voz del Paseo Boricua's Top 10 Under 30, Windy City's Times 30 Under 30, and DIFFA's Chicago IVI, IPO Gay and Lesbian Caucus, Glenn Sudbury and Leadership Award from the National Center of Sex Education, Havana, Cuba. Mr. Calderon has a bachelor's degree from Northeastern Illinois University and is currently pursuing a master's in public health at the University of Illinois at Chicago. Before we continue, just a quick note about the Puerto Rican Cultural Center of Chicago. The Puerto Rican Cultural Center of Chicago is a community-based grassroots educational health and cultural services organization that was founded nearly 50 years ago in 1973 on the principles of self-determination, self-actualization, and self-sufficiency that is activist-oriented. And here he is. Mr. Calderon.
Yes. Hello, Doctora. How are you? This is
Wonderful.
Juan. Sorry, Doctora Ponte.
No problem. I'm so happy to have you join us again and to say a few words to our audience today.
Thank you, Doctora Ponte. And thank you, everyone. I'm actually currently in Springfield doing some advocacy for the Latino community, for the work in terms of housing. And right now, I think redistricting is a topic that is currently being discussed. But nonetheless, good afternoon, everyone. My name is Juan Calderon. I'm the Chief Operating Officer at the Puerto Rican Cultural Center. The Puerto Rican Cultural Center is an umbrella organization, a community-based, grassroots, educational, a community-based organization that offers educational, health, and cultural services. Is expanded. It's been expanding its reach to really serve different demographics that have been impacted by different health inequities across communities of color, and we have a specific emphasis on Puerto Ricans and Latinidad, and specific within the Latino communities. We at the Puerto Rican Cultural Center are founded within the principles of self-determination, self-actualization, self-sufficiency that is activist oriented. And I think that is important as part of the discussion, in this webinar today about the elderly population. For us as Puerto Ricanos, we always value our matriarch and patriarch in our families, and they are the ones that they're the baston. They're how would I frame it? They are the ones that keep the family unit together. And when we think about unity and when we think about the construction of family, I think that this webinar serves as a very important step, because we will all hope to reach that stage in life. And I think as a long hauler, and as many people now with this pandemic have realized, life can be short, and we have to be able to provide the best quality of care. But life can be short within the context of how you make it short. I think it's important, and I'll end this welcoming remarks to ultimately share is that COVID and this pandemic has made community-based organizations like ours more active in policy and in driving some form of change, because we are currently seeing the gaps that exist in healthcare, the gaps that exist in community-based funding that can leverage and create ultimately jobs that can then create a holistic care and wraparound services for the elderly population and for the older population. And I think that for us at the Cultural Center, and I'll leave that, some of the work that we are beginning to think as we move into strategic planning is, how do I see services for the elderly population in an ever-evolving community and city, within the scope of services and programs to provide wraparound services for populations that are reaching communities of color from other countries vis-a-vis due to climate change, vis-a-vis due to other quality, to a better quality of life. So with that, I want to welcome everyone to the webinar. I got a little bit long-winded, but thank you everyone very much. And I hope that you guys learned many objectives about what are the current services that are being offered in our communities of color when it comes to the older population. Thank you.
Fantastic. Thank you, Mr. Calderon. Next, we're incredibly honored to hear from Dr. Marta Cerda, CEO of ASINE Healthcare Services. Now, Dr. Cerda is very accomplished, so bear with me because I have a lot to say about her. But Dr. Cerda is a dedicated leader with over 35 years in the business. not-for-profit, philanthropic, and political arenas. She is at the helm of one of the largest and oldest Latino-led non-for-profits in the city of Chicago, ASI, where she oversees major contracts with the city of Chicago and the state of Illinois, serving hundreds of clients and managing approximately over 320 employees. Dr. Cerda has elevated ASI's commitment to Chicago's Latino and African American seniors through its multicultural approach to services. This past year, Crain's Chicago business recognized Dr. Cerda as a notable women in healthcare. Dr. Cerda is a recognized thought leader in the areas of healthcare, population health, aging populations, and workforce development. She is the vice chair of the Illinois Legislative Latino Caucus Foundation, and she is the vice president of the Illinois Association of Community Care Providers Home Care. And she's presented at the National Multicultural Marketing Conference this past June of 2019. So a couple of Junes ago almost. Dr. Cerda was recognized by Negocios Now as a member of the Who's Who in the non-for-profit community, and in 2020 as Healthcare Latino Leader Fighting COVID-19. Prior to leading ASI, Dr. Cerda was chair of Norwegian American Hospital Board of Trustees, a corporate board. She's one of the few Latinas to hold such a position in the state of Illinois, and is a former chair of both the Governance Committee and the CEO Search Committee. Dr. Cerda was Deputy Director of Cook County Works, where she oversaw internal operations for the county's employment and training system. She dedicates a significant proportion of her time to volunteer and civic participation. And most recently, Dr. Cerda became a National Museum of Mexican Art trustee. She's a member of the Illinois Unidos and a member of the Healthcare Committee of the Puerto Rican Agenda. Dr. Cerda holds a Bachelor's of Arts degree from Smith College and a Juris Doctor degree from Loyola University of Chicago School of Law. She is a candidate for the Northwestern Kellogg School Executive Scholar Program, because education always continues. And she was a National Hispana Leader Institute Fellow, where she attended the Center for Creative Leadership and a Harvard Kennedy School of Public Policy course. And I'm telling you, those are just highlights of the highlights that you see on the screen, because Dr. Cerda is just that accomplished and phenomenal. So we are truly honored to have her join us today. Dr. Cerda, adelante.
Thank you. Thank you, Lisa. My goodness, what a wonderful introduction. Thank you so much for creating this webinar to talk about our Latino elderly. And my heart, and from my heart, I thank Juan Calderon for your passion for our Latino elderly. Thank you very much. Muchísimas gracias, Juan. You are such an advocate for us. So I just wanted to say a few words about ASI and any healthcare. So we have an array of services, a circle of services to help you to get access to services so you can age well and recover well in your own homes, the safest place for your care, especially during the pandemic. And one of the reasons why we have such an array, you can go to the next slide, comprehensive array of services, is that it should not be hard for you to grow older. It should not be hard for you to recover from a surgery. And that's why we have a one-stop shop for your services. So you just call us and we'll help you. Well, first and foremost, we have our in-home care. I'll just go briefly through our services. We have many. A Medicaid waiver program. So that is those are services available to you. So you can have individual caregivers help you, or home care aides help you in your home with your daily tasks of living, grocery shopping, laundry, which became more important to have this assistance during the pandemic, to have someone else going out and getting your groceries and medications and bringing them back to you, and helping you and knowing that you had a companion during this very challenging past year or so. We also do have behavioral health services, very important, especially, for example, if you're suffering from clinical depression. You can get support in your home. Call us and we'll see if you're eligible for those services. Heavy duty chore, if you're really overwhelmed facing eviction, we want to let you know those services are available and we can bring a team out to help you. Telehealth we'll talk about in a moment. Insurance navigation, we have on our staff a senior health insurance program counselor who can help you with your Medicare and Medicaid. Feel free to call her at any time. Private care, services for cash, respite care if your family members need a break. And one of my favorite ones is care transitions. If you're in the hospital, you've had a surgery and you're heading for home, or you've had an acute episode, we want to make sure you go seamlessly and you're transitioned seamlessly from a hospital or a skilled nursing facility back into your home without any gaps in care. I can say I had surgery, I didn't have that assistance, and I got an infection, and I had to go back to the hospital. Let's avoid that happening. Home health. Many people don't know that you can have a nurse, a physical therapist, you can get an x-ray. I had COVID-19 and an x-ray machine came to me because I could go nowhere. So the x-ray was shocking. It came in. It's huge. It came into my home and gave me an x-ray. We can take your blood at home. We can connect you to a doctor. A doctor can visit you at home. We did that as well. So all of those services are critically important to keeping you healthy and educating you about your health. Now, next slide. Just briefly, I did want to say that ASI has been a training hub for home care since the 1980s. My nurses also were recognized in Cranes for their work for COVID-19. And we have high customer satisfaction scores and do specialty training. Next slide. So telehealth is what we were recognized for. Some of our nurses were recognized for telehealth. This is important to know. We actually took care of COVID-19 patients when many other agencies would not. Our nurses went in and they made sure our patients had the ability to check their blood sugar, their temperature, very important for COVID, their oxygen level, important for COVID, weight, and all of those measures right in their homes. And that information was sent to our nurses. And then they were just able to help them decide if they needed to go to the hospital or if they could heal at home. And our nurses also made sure that they did not infect their family members during this difficult time, which was a huge achievement. And that's why they were recognized. Next slide. Thank you, Lisa. So basically, we took quick action. We were able to do a lot of wound care. And I can say when I had COVID, it helped me a lot to be able to see what my oxygen level was. I just can't say enough about that service. All right, now let's talk about the value of clinical trials for Latino elderly. ASI in particular, you can go to the next slide. Thanks, Lisa. ASI, most of our clients, basically all of our clients, are over the age of 65. So this is why this topic is of most importance to us. And most of our clients are also Latino, 57% Latino. So let's talk about why this is so important. Well, first and foremost, equitable participation based on age can advance medical knowledge and test the safety and efficacy of new treatments. And then that can help the general population. That's super important. Many people don't think about that. The test on the elderly can help others. Next, it's important to note that scientific evidence has shown that there are genetic and physiological distinctions between gender and race that can influence disease risk, disease treatment, and severity. So age and race matter in clinical trials. Now, the exclusion of our Latino elderly population is problematic because we bear a great burden in the healthcare world. And has been mentioned, and the Puerto Rican Health Summit pointed out, Latinos suffer disproportionately from certain chronic ailments, like dementia, for example, where we're impacted at an earlier age. Depression, we're many times more likely to suffer from depression. Diabetes, especially in the area of Humboldt Park, Belmont Craig, West Town, we have high rates of diabetes. Cardiovascular disease, cancer, Parkinson's, and others. So because of that, we need to have racially focused trials so we can tackle effectively these healthcare disparities. And again, those trials can benefit the general population. Next slide. unfortunately, we have low participation rates in clinical trials for our Latino elderly. Older adults in general carry 60% of the nation's disease burden, but yet they represent only 32% of the participants in phase 2 and phase 3 clinical trials. There is also low participation in research on Alzheimer's disease, arthritis, epilepsy, and cardiovascular disease, for example, a few. That's a problem because, as I mentioned, those are illnesses that negatively impact our Latino elderly. Sadly, I hate to report that there's low participation rates in COVID-19 trials. Yes, that's very unfortunate. As you know, and I think as our Illinois NIDOS team has and the Latino Policy Forum have been getting out information on the fact that Latinos are affected many times more with COVID-19. And I know especially in the beginning of COVID-19, our Latino elderly were dying in large rates from COVID-19, more so than other ethnic populations, especially here in Chicago. And we are also more likely to die from COVID-19 than the white population. But for example, Latinos are 34% of the COVID-19 nationally, at least when I pull this data. But with the Moderna clinical trial, they only had 13% participation in their trials. I can say that I myself participated many months ago in a panel discussion to recruit Latinos into the AstraZeneca clinical trials that were happening here. That was with the help of a Rush doctor and the Latino Policy Forum, led by Hugo Balta. And we were really pushing to make sure people knew about the trials and made sure they understood that the risk of dying from COVID was far less than from the benefit of participation in a clinical trial. So that's how we need to tackle it, and we'll talk more about that. We need to get the word out. We need to have our voices heard about the need for participation. Next slide. So now I wanted to talk a little bit about what the barriers are to Latino elderly populations participating in clinical trials. First and foremost, as I mentioned, there are comorbidities that we have, and that you may be excluded from a trial based on a comorbidity. Economic constraints, this traditionally is a problem. Having the funds to get to and from a clinical trial. Language barriers, a top problem. Cultural barriers. Underinsurance, the lack of insurance. And here I wanted to note for Illinois, fortunately, our Illinois legislature passed a law that allows elderly above the age of 65 who are undocumented to apply for Medicaid. They can apply, they can get Medicaid. Great news for Illinois. They are leaders in that effort. Next, our Latino elderly also suffer from physical disabilities. So hearing difficulties, listening on the phone calls, vision impairments, having difficulty doing and completing the surveys, physical immobility issues that may make it difficult for them to get to and from clinical trials. Next slide. Thanks. And also, the distance to a study site may be an obstacle. I also wanted to mention one important issue. The family members may have a concern about the risks of the trial. I can say I saw on Facebook someone asking if their family members should participate in a clinical trial. And there was a huge negative response to that, and I'm sure they probably did not participate, sadly, in that trial. It was hard to see. So that's a problem. But why did they get negative feedback? We'll go to the next slide. A major factor in the concern about clinical trial participation for our Latino communities is due to historic racism in research. And 52% of Latinos have a lack of trust. And then I would say this is our number one reason. So for example, here, my aunt, when she was a teenager in the 1940s, was given an experimental treatment that resulted in her having epilepsy. not good. And when I mention her story, other Latinos start to talk about stories about their aunts or their mothers or their grandparents. So we must acknowledge that this did happen. There were mistakes in the way in which clinical trials were taking place for several decades. And that is, we must acknowledge that. And that's part of having transparency and to build new trust in current clinical trials. There used to be forced participation without consent. There was the use of biospecimen samples without consent. And I have to say, this was a lot in the news. During the COVID-19 vaccine process, there were trials that happened in the African-American community, for example, where that happened. There may be a lack of access to people who speak Spanish. And again, out-of-pocket expenses, a lack of confidentiality. All these things happened, and we must acknowledge that. But let's turn to our solutions for these challenges. To the next slide. Thank you, Lisa. So number one, it's super important to have a diverse scientific workforce. I was so happy to see Pfizer letting us know that there were minorities who scientists who helped to develop the Pfizer vaccine, for example. That's a great example of what we should be doing, getting that information out. Next, we need to have more investigators who are Latino and who are culturally sensitive. Third, we need to have investigators who receive anti-racism, bias, and cultural humility training. And I actually personally feel there should be a mandate at the federal level that all investigators should have this training. Next, we see the importance and the growth of our Latino communities. And I have to say, our Latino elderly population is growing at a huge rate. So we should have a focus on our needs and our entry into clinical trials. Now, that also there are other aspects that have been addressed via policy changes. So now you do have to reveal, get consent, and have to keep information confidential and disclose participation rights. You know, this is something that's now required. I also highly recommend more geriatric training and for the investigators, so they truly understand the needs of our elderly population. Finally on this page, an important one for me is let's use our trusted messengers. I have to say, ASI has done a series of webinars with priests, pastors, and ministers, because we understand the value and the trust that they have with their congregations. So we have partnered with them to get the message out this past year. Partner with your physicians, your community-based agencies, your clinics, promotores de salud. Highly important to get more funding for our community health workers, because they are in the front lines where our elderly community is. They're in the churches, they're in the workplaces, they're in the food pantries, they're where they are. We need more promotores de salud to help us to get our Latino elderly into clinical trials and to support them throughout the process. Next, my favorite subject, caregivers and clinical trials. There is a huge value, next slide. There's a huge value in engaging caregivers in supporting our Latino elderly into getting into clinical trials. A growing number of our Latino elderly are now having caregivers. They may be reluctant. I can tell you that's a challenge sometimes. But ultimately, like my father, he didn't want to have a caregiver, but he got too stressed out and now has caregivers. So that's really important. So a growing number of them are in the home, and our Latino elderly are listening to them and to their family members to hear their views on a clinical trial. So I highly encourage those conducting clinical trials, bringing caregivers into the process. And you do need to check to see if that caregiver also supports the participation. They may oppose it. So check on that first. But they can actually help with the completing of documents, with getting our Latino elderly to and from a clinical trial. They're just super valuable and should be a part of the process. And also, I wanted to note that there is a spiritual and religious component to a decision about whether or not you're going to enter a clinical trial. And we must recognize that. So although I mentioned over 50% have mistrust in trials, many more, I think it's around 75%, will participate because they feel spiritually moved to participate in that trial, because they feel that they may help their grandchildren or their family members to get better or to get a better treatment. And so they will then, due to their spiritual beliefs, go forth and participate in a clinical trial. So spirituality and religion does play a huge role in Latino elderly's decisions about clinical trials. Next slide. I did want to note that it is important to have age appropriate and adjusted and documents adjusted for literacy levels. It seems obvious, but we don't always see that in our settings. So I wanted to also say Illinois Unidos, one of our sponsors, is an excellent example of adjusting for age and literacy levels, and they have great documents and models that you can follow. They even have a Our Lady of Guadalupe bookmark. So they definitely know how to get the information out into the churches where people are in the way that they'll be able to read it. So definitely go to illinoisunidos.com and take a look at how they have better adjusted their materials for our population. Next, I did want to note that during the pandemic, there was a great opportunity to show that trials at home may be a great option. If you can conduct a clinical trial at home, that removes many of the barriers that I mentioned to clinical trials. The transportation's not a problem, the geographic barriers, so many things get knocked out if you're able to conduct a clinical trial in that manner. And I did want to say, when conducting clinical trials, there can be an added value to the trials by having supportive services linked to the participants in a clinical trial. And we do need, geriatric training and navigators who are helpful throughout this process so they can resolve some of the challenges and barriers to participation in a clinical trial. And finally, I did want to make a note about the fact that we have an array of tools that can be used to draw in our Latino elderly into clinical trials. As I mentioned, we did a webinar, it was posted on Facebook, it was live on Facebook. So we definitely were using Facebook a lot. So that's a good tool so you can target a particular population. Advertisements can be targeted by age, ethnicity, and education level. And this can be done in an ethically appropriate manner. And I did want to also note for our Latino elderly, the radio is a great source of information, and we definitely get more impact when we are doing interviews or advertisements on the radio where our Latino elderly are listening to information. So I encourage the use of every single tool in the toolbox because the value of gathering the information and having effective treatments to help us to get rid of these healthcare disparities is high. We need to find these solutions so we can get more of our Latino elderly into and retain them in clinical trials. Back to you, Lisa.
Thank you so much, Dr. Cerda. Really interesting that you would highlight community health workers. It's been a common thread that I think we need to continue to pay closer attention to how to best leverage those key trusted voices in the community, like community health workers. But we've heard that throughout the series, each and every week that we've hosted a session, the importance of working with our community health workers or promotoras de salud. Or as we learned from at the Puerto Rican Agenda Health Summit last week, from Carmen Yulín, former mayor of San Juan, gestores de salud was the first time I heard the term used, but apparently it's widely used throughout Latin America. Well, next, we are Excited to introduce to you our next guest speaker for today, Dr. David Marquez. And I'm very honored to have Dr. David Marquez here because early on, when I was trying to find my way and working on my dissertation, he was one of those really helpful mentors that gave me some valuable insight and guidance. So very excited to hear him speak today about his work. Dr. David Marquez is professor of kinesiology and nutrition and director of exercise psychology of the Exercise Psychology Laboratory in the College of Applied Health Sciences at the University of Illinois at Chicago. Dr. Marquez is a visiting professor with the Rush Alzheimer's Disease Center, and he is a nationally recognized expert on the important role of physical activity in achieving and maintaining mental health and physical health. His research has focused on reducing health disparities and developing physical activity interventions for vulnerable populations. Dr. Marquez spends the majority of his time working with the Latino community, older adults, and individuals at risk for Alzheimer's disease. His areas of expertise are in health disparities, health promotion, and gerontology. In 2016, Dr. Marquez was appointed to the 2018 Physical Activity Guidelines Advisory Committee to review scientific research and submit evidence-based recommendations to the U.S. Department of Health and Human Services for updates to the guidelines for all Americans. Dr. Marquez is a fellow of the Society of Behavioral Medicine, the Gerontological Society of America, and the American College of Sports Medicine. He earned a doctoral degree and a master's degree in kinesiology from the University of Illinois at Urbana-Champaign, and holds a bachelor's degree in psychology from Loyola University of Chicago. And I will say this again is a humble resemblance of the amazing work that Dr. Marquez has accomplished and continues to build on. So very delighted to welcome Dr. Marquez this afternoon. Adelante, Dr. Marquez.
Well, thank you so much. Really, what an honor and pleasure to be here with esteemed colleagues. I always say that I've been so fortunate in my career. Sometimes when I look left and right, maybe even on these Zooms, looking left and looking right at the people around you, it's amazing, to be considered for a panel like this. So I'm extremely appreciative to be here, and all of the people that have helped me get to where I am in my career. One of those being Dr. Giacello, and so I'll talk a little bit about how I got started on the southeast side of Chicago, in the networking that I was able to do through her center and her grants. And you're gonna see some overlap, but this is good, right? So like Marta and I have never collaborated together, not yet, at least. Yet her experiences resemble my experiences, right? So I'm a researcher. That's first and foremost what I do related to the health of older Latinos. And so in this slide here, you've probably heard about the graying of America, right? With this demographic shift and so many more older adults in the United States. And this is true, right? So if you look at data that's a little bit older now, 2000 to 2009, older non-Latino whites, you saw a 10% increase in those 65 and older. So that's a pretty big increase. And in the absolute number, that's a lot of people. If you look at that relative change amongst older Latinos in the United States, there was actually a 59% increase over that same time period amongst older Latinos in the US. All right. So there is a graying of America, but it's a graying of all people, and maybe some more than others. Well, the genes aside, right? So recent data show in 2017, Latinos were 8% of older adults in the US. By 2060, projected to be 21% of older adults in the US. So as a researcher, we need to understand and work towards inclusion and welcoming. So people are there. We have had, and many have had, be fortunate enough to have older Latinos participate in their research, but it's not coincidence, and it's not the methods that a lot of researchers use to conduct research. The people are there. It's on us, the research teams, to create welcoming environments such that people want to participate. Older Latinos will want to participate in our work. And you heard Marta say about the distrust and mistrust. It has been created, and now it's on us, not to blame people for not trusting us, but to find ways so that we create trusting environments. Next slide, please. This is the way it typically works, or it has worked historically in research, right? The real world, if you want to go to the real world, you get off on this exit of the expressway. But if you're in academia, you go off in this. And so we live in these like separate worlds, and we can't have this. And thankfully, this has changed over the years. Much more community engaged research, CBPR, community-based participatory research. So we're changing this over time, but this is the perception, of course, that many people still have, and rightfully so, right? That, oh, in academia, oh, the research you do, that's not the real world. So these are the kinds of things that we have to merge together so that we are viewed in the same space. Next slide, please. I advocate for people to use some sort of a model in doing their research, especially in the beginning. So this is one such model, is developed by my colleagues at the Rush Alzheimer's Disease Center, Doctors Crystal Glover and Raj Shah. And it's the engaged model, and really the focus of there's work to do upfront. The N, the networking. We're not trying to get something in return, right? We are trying to learn about different communities. And I have had meetings like this even in Humboldt Park, in where a community-based organization leader, said, okay, so what do you want from me? Right. And I said, to be honest, nothing right now. Like, I want to learn from you. I want to get to know about you and your organization and the people that you work with and serve, so that I can better understand, right? So that networking that needs to take place, and giving first. So with Rush, we do a lot of community presentations. What are the topics related to the brain that you are interested, that the people want to hear about? And a lot of times it's about dementia and Alzheimer's disease. Are they the same thing? What is it? How do I get it? How might I not get it? These types of things. It's relationship with exercise or diabetes. So giving first, and then advocating for research. Because like Marta said, we need data, we need results that come from our Latino community. Then we don't have to assume that findings from other groups also apply to us. We're part of the research, and those results were generated solely from us, or we were included in those samples, and that's the importance. And then we give back, continually give back. And then over time, the last parts are to engage former participants in study design, carrying out the study. So again, this is one type of a model that can be used to kind of guide the research. Next slide, please. And over time, I began in Chicago. I came back to Chicago in 2007 at UIC. And over the next couple of years, really did a lot of networking. I mentioned Dr. Giacello and her Midwest, I'm gonna mess up the name, Midwest Latino Center for Research, Training, and Policy. I'm so sorry, it is wonderful. It was so wonderful. And then there was a grant on the Southeast side with SEDCOM, the Southeast Development Commission. It was related to diabetes. And so I got to go to their coalition meetings. And then there was a worker, Tony Piakowski, I think his name was, and he said, hey, if you're doing work with older Latinos, you should connect with Julia Lopez. She's with Via Guadalupe Senior Services. And so I met with her, and I give so much thanks to her because she trusted in me and the research. We are friends to this day. And so there you see pictures of the pilot study of the Bailamos dance program, which was done at Via Guadalupe on the southeast side of the city in South Chicago. And so many of you might also recognize the dance instructor, Miguel Mendez. So he and I created, the Bailamos dance program. He brings the dance expertise, I bring the science, and we make a really good team together. So dancing is fun, dancing is social, there's music, it's just festive. You know this. Many scientists don't know this, and so it hasn't been studied a lot. So if people engage in dancing, how does this help? What kind of health benefits can happen from it? And so it's not saying that like traditional exercise doesn't work. We know traditional exercise works. But if people have no interest in doing it, it doesn't matter, right? So Miguel and I created the Bailamos dance program. Next slide, please. So Bailamos is a 4-month program, twice a week for 1 hour each week, 4 different styles of dance. You'll notice the Caribbean flavor to the styles, which is largely because Miguel is Puerto Rican and was in the Humboldt Park neighborhood for a long time, just recently moving his dance studio. And so we purposefully made it from the easier styles to learn down through the more difficult ones. And we also had discussion sessions to talk about physical activity. How could you incorporate more movement and activity in your daily life? So there's individual dancing, partner dancing, and then sessions of open dancing. And in many of our studies, it was research, so we also had a control group. And this was health education. It was developed for older adults and in Spanish. All the dance program has always been in Spanish as well, by the University of Illinois Extension. Sonia Lopez and Veronica Aranda, who were the extension educators. So the same amount of contact time. Next slide, please. We had various forms of funding from our UIC campus, the Roybal Center for Aging, from the Alzheimer's Association, and then from the National Institutes of Health as well. And so we had our trial, the BILA trial, and there you can see the acronym. And really, I relied upon my really seasoned veteran physical activity and aging experts that were my co-investigators or consultants, and you can see them here. And overall, I think we did a really good job. We randomized 333 older Latinos into either the dance group or the health education group. And we are still in the process of publishing data, but currently we have shown greater changes in physical activity for those who participated in the dance program relative to those who participated in the health education program. We have seen changes in aspects of cognition, for example, aspects of memory, more so in the dance group than the health education group. But we ran into issues with conducting the trial. Next slide, please. So this is from a publication that we have. There were 3 groups. So myself and my experiences, Dr. Susan Hughes at UIC, they were doing an adaptation of the Fit and Strong program for Latinos, and Dr. Amparo Castillo, who at the time was doing work with older Latinos with diabetes and using Tai Chi as a form of physical activity. And we were running into a lot of the same issues. So I'm briefly going to present. This slide will be on some recruitment challenges we had. The next slide, retention challenges that we had. So Lisa, if you could advance it, I think it will highlight, yes, there, okay. Lack of trust, right? So Marta mentioned these things. And here you go, Lisa, here it is again. What are some solutions or strategies? Promotoras de salud, or community health workers, right? These tried and true ways to increase engagement in trials. The second one, working late into life, that flexibility that's necessary with these types of interventions. they can be tough when you kind of aren't able to have as much flexibility like us. We know that Latinos will work later into life, right? So somebody late 60s, not necessarily retired with a pension, something like that. No, continue to work hourly jobs. And so that flexibility. Next slide, please. And I call it circumstantial. You know, this is not cultural, of course. This is circumstantial of the way society has been set up for Latinos. Low literacy levels. So how are you going to collect data? I was on a call earlier today letting people know I know researchers who will have surveys, they mail them to people and say, here you go, complete them, put them in the self-addressed stamped envelope and mail them back. We don't do that because we don't ask about literacy levels. We don't know. And we want the data to be accurate, valid, and reliable. So we do that kind of thing interview style. Next slide, please. Here, I'll just be going over a couple others as well. Advance one, Lisa, if you can. Traveling back home, we had a number of people who said, I'm really enjoying the dance program, but say my sister is sick in Mexico, or in Puerto Rico, so I need to go and be with her. And we say, oh, okay. Thank you for letting us know. We hope everything is okay. You're welcome to come back to the dance classes. Do you know when you're coming back? Well, no, for right now, it's a one-way ticket, and so I really don't know, right? And these are things, people that do research trials, many don't experience these types of things because they don't include Latinos who might have family either in Puerto Rico or Mexico or somewhere else. Next one, please. And this, we do things in Spanish. So, you know, the logistical, you all probably know better than me, of trying to include Spanish and English in one session, in one class, when you have to take time for translations into whatever the other language is, from Spanish to English or vice versa. You lose the flow, you lose the discussion. And so, you know, I advocate for, okay, let's have classes in Spanish, right? We know that resources and programs are less available in Spanish than in English. And so let's do these kinds of things in Spanish. So these are some considerations. I think you heard the overlap, but not direct overlap. You know, our experiences in this session today really complement each other, and we're experiencing the same kinds of things. So these are considerations to have when we were trying to encourage, motivate older Latinos into research, and on our end, making sure that it is set up so that it's safe and welcoming for people. Thank you.
Fantastic. And if you want to learn more about Bailamos, you can visit the URL on your screen by going to IHRP's website, which is part of the Research Center at the University of Illinois at Chicago, and search for Bailamo, or again, use the URL on the screen. So again, on behalf of the Puerto Rican Cultural Center and the network of the National Library of Medicine, we want to thank Marta and David, Dr. Seda and Dr. Marquez, for sharing their experiences and their expertise working with Latinx aging adults. You both brought very different perspectives, yet a crossover of a lot of the common thread in terms of the importance of acknowledging mistrust and just being respectful and addressing and approaching recruitment with older adults in a culturally responsive way and acknowledging their contributions. And so we want to kind of underscore or highlight, right, the value of including our aging population to ensure that services, treatment, and interventions are properly aligned to meet their needs. So I do really want to, value and acknowledge how each of you are intimately involved in community efforts and how you leverage those partnerships, those critical partnerships to increase representation and services for our Latinx elders. So now we're going to open for questions. Any questions in the chat, Kim?
Oh, I have one question from Dr. Giacello, and this one's for Dr. Marquez. Are you still recruiting older adults for the Rush Older Latino healthy adult study?
Yes, absolutely. So we have over the past year with the pandemic is definitely slowed down. It is the Latino Core, CORE, Latino Core study. It's a prospective study, so it's not an intervention. To date, we've recruited 244 older Latinos into it. We are recruiting Latinos 65 and older, although 60 and older could work as well, who do not have dementia or don't have a diagnosis of dementia, to do annual testing, all types of testing from surveys to blood draw, potentially MRI, although that's an addition, some mobility things, because we want to see over time what are the factors that lead people to develop Alzheimer's disease, Latinos specifically, and what are the factors that are more protective? Maybe behavioral, like physical activity, but also cultural, maybe familismo, and those kinds of things that might be protective. So its testing is only one time per year. It's an extensive testing on one day. We typically do the testing in people's homes. But of course, with the pandemic, we haven't been doing that. But we're working our way back to being able to do that. So Lisa, I could always share information with you that maybe could be sent out about the study.
Absolutely. We can share that information when we circle back with our attendees today. Our attendees from today. If there are no more questions in chat, I have actually a quick question. And I know we're a little bit over time, so I'll keep it to one question. But I heard both of you talk a lot about, being cognizant of the barriers and various different opportunities that we can from the research aspect or even from the service provider aspect used to increase engagement and participation. But what would you say are some of the critical things that are of value in motivating older adults to feel that they have a space and a purpose and and that their participation in research will yield contributions, endless contributions?
Well, I can say that, and I wanted to mention that there is not enough research on our Latino elderly in general. In addition to participation in clinical trials, I found that out for another panel that I was on. Very discouraging to see because, again, our population is growing at large rates. So I would have to say the idea of more clinical trials at home may be the best way to remove a number of the barriers. I have to say the Rush trials process, their study, really effectively works at including cultural aspects to the training. And again, I would have to say the engagement of our religious or spiritual community is important because, again, it's like a calling to help others. It's just part of who we are as Latinos, and touching upon that would help to recruit more Latinos into studies, as long as you remove the other barriers as well.
Yeah, and to add on that, right, like, so we care about our own health, we care about the health and well-being, quality of life of our families. And it's the reason a lot of people talk about participating in research on Alzheimer's disease right now. We're transparent with people that by participating in this, will you directly benefit? Perhaps, but to be honest, probably not, right? But what you contribute for Alzheimer's disease to help us learn, can at some point, will there be a cure? Can we help find a cure? Can we prevent it? And a lot of people mention about, a lot of older Latinos will talk about, so that, my kids, my grandkids, my future generations don't have to worry about Alzheimer's disease and it's a dreaded disease. And so how can we, if I can contribute to that, then that's what I want to do. And so that's a lot of the reason that people are participating.
Fantastic. Thank you so much, both of you, again, for your perspectives and your time today. If you want to connect back with our presenters for today, I'll share their contact information again in just a few moments. But first, we wanted to share a few resources. These resources here are in relationship to some of the services offered by the Puerto Rican Cultural Center, Vida Sida, El Rescate Transitional Living Program, and Trans Chicago. And you can also connect with the Puerto Rican Agenda of Chicago. And to learn more, you can use the URLs posted on the screen. Hopefully you can take a quick screenshot. If not, you can view the video later as well. In addition to that, we wanted to share a few resources from some of the services that you've heard about today and some additional services that hope will be helpful to our aging and older adults. ASI Home Healthcare, you can use the URL on the screen to get more information for those services. Illinois Unidos, Casa Central, and the Rush Alzheimer's Disease Center. And if you would like to participate in research and contribute to science and scientific learning and scientific knowledge, please, we highly encourage you to visit joinallofus.org. The All of Us initiative helps us learn more about each and every one of us through genetic testing information that will inform future interventions. So please do visit the All of Us website for more information. And some upcoming events being hosted by the PRCC. Is Xiomara with us?
Hi.
Hello.
Sorry. Yes. So, yep. Just a couple announcements. As always, we have El Jolgorio de Salsa y Más on Saturday. We're going to be featuring DJ Azúcar, who's going to be throwing it back, giving us some Latin house, salsa, bomba y plena. So definitely come through on Saturday to Huepa Mercado del Pueblo, and then our nutrition class and wellness series is continuing, so we hope to see you all there. Thank you.
Thank you, Xiomara. We also want to hear from you. We want to hear your perspectives, your opinions. There is a URL posted there for you to complete the survey. We ask you to wait until we forward this information to you via email. Currently, the site is down for refreshing and the link is not active today. But as soon as it does become active, we will follow up with all of you, and we hope to hear from you. And as promised, here's some information for you to connect back with us if you have any suggestions, recommendations, or you just simply want to connect with us about some of the research or work that's been shared here today. To send any information or suggestions for future sessions, you can send an email to info@thanamaconsulting.com. To learn more about the Puerto Rican Cultural Center, you can visit prcc-chgo.org. And there you see all of our emails listed if you want to reach out to any of your presenters today, including your humble moderator. You can reach Mr. Juan Calderon at juanc@prcc-chgo.org, or Dr. Marta Cerda at mcerda@asiservices.org, or Dr. David Marquez at marquezd@uic.edu. And as we close, we wanted to dedicate today's webinar to David's late father and Marta's late mother. I don't know if each of them want to acknowledge their names because I want to make sure that they're captured correctly. If you want to jump in quickly. And
sure. My mother was Maria Basilisa Rodriguez Gonzalez Cerda.
And she was an icon, well known for all of her efforts here locally in Chicago in the field of education, correct, Marta?
Thank you so much. She brought bilingual education. She helped to create the Latino Institute, which later morphed into the Latino Policy Forum, and was ran the Mayor Harold Washington's Office of Employment and Training.
And David, your father? Thank you.
Yes, thank you so much. My father, many knew him as Frank, passed away about a year ago from Alzheimer's disease after an 8-year battle. Jose Francisco Javier. So thank you so much. Really appreciate it, Lisa.
Absolutely. We are our parents' legacy, and they each of our speakers today had remarkable shoes to fill. And I think they've done well, right? As we saw from their own bios in sort of fulfilling and continuing their parents' legacy. As you continue after today's session reflecting on the invisibility that takes place as we age. Aging adults get stigmatized, get stereotyped as not being as competent or as capable in all spaces. People discount their intellectual abilities and worth in the workspace and at home. We forget our abuelitos. Don't forget your abuelitos. Please don't forget to love on your own legacy. This is ageism, and it's a form of discrimination. So I just wanted to put that out there for your consideration, to treat others as you'd like to be treated, with love and respect. Be kind and loving to one another, and plain and simple, mi gente, lean on love, compassion, and empathy. Together, we can make a difference. We want to, before we go, say thank you and muchísimas gracias to Mr. Calderon, Drs. Marta Cerda, Dr. David Marquez, our invited guests for today. We want to thank our sponsor, Darlene Caskey, with the National Network of the Library of Medicine. We want to thank our partners from the All of Us Project, Ms. Monica Rodriguez, and from the National Association of Hispanic Nurses, Nurse Susana Gonzalez. We also want to extend a very special thank you to Dr. Aida Giacello. Without her leadership and her own legacy that we are all very indebted to, we would not be here today, as she's helped make these series possible. And today's the last session, but I want to say it's not our last one. And also, I don't want to forget our staff and our team that has been so diligent. You saw the slide earlier with all of their names captured. This has been a team effort between the PRCC, our partners, and the network of the National Library of Medicine. So we're really, really grateful from Tanoma Consulting to have been a part of this work. But this is not the last of it. We're going to come back with some more sessions, so stay tuned. We have resources coming and informational handouts. And so you can find all of those on a microsite that's going to be available through the Puerto Rican Cultural Center site called Info Salud. And here's a photo of my late grandparents, Miguel Ángel Vélez and Juanita Vélez, part of my legacy. Thank you again for joining us today. Peace and love. Gracias.